from Phatak Materia Medica, that is Abrotanum. Abrotanum is a very important remedy in day-to-day clinical practice. As many of patients comes in our OPD and says that, doctor, my child eats well but still keep getting thinner. This is a common version of patient that we commonly heard. Another version we heard that, doctor, after my loose motion stopped, suddenly my joint pain started. Or, doctor, my one problem goes, another problem starts. These are the common versions we see in the common OPD patients. So, however, in many of patients you see in that a disease move from organ to another organ, or when the disease does not disappear but it change its address, means it change its organ. This is the we have to think of Abrotanum. Today we are not studying a remedy. Today we are understanding the what metastasis in homeopathy, or Abrotanum has uh, two M's which are very important, that is Marasmus and metastasis, and around that the whole clinical picture or whole practical application of Abrotanum is depends on that. So Abrotanum is not very commonly used in earlier in my practice, but nowadays it indicates many of patients from small children to adults, mainly in also cancer cases. According to Phatak, the Abrotanum is the remedy of marasmus, metastasis, suppressed discharges, weak nerves and wasting. This is a remedy where appetite is persistent, but patient is eating well but not gaining weight. Appetite is persistent, digestion is poor, nutrition is faulty, and emission is progressive. Means that patient eats properly but he is not getting his foods digested well, and nutrition is not reaching to his body, and day by day his emaciation is progress, especially more indicated in children's, more often in boys, where the marasmus is of lower extremities. Upper extremity is good but lower extremity is thin. Phatak clearly places Abrotanum as a deep acting constitutional and pathological remedy, not for a casual prescribing. Abrotanum is the remedy of nutriment failure, not appetite failure. Means appetite is good. You did not have to increase the appetite of have to give appetizer, but we have to correct the problem of nourishment or assimilation. Main essence of the remedy is uh, these patients live in a state of internal weakness. Things does not flow properly where it is, means nutrition, blood, emotion, or disease process. Everything becomes blocked and suppressed and shifted. Central theme that disease moves from, means disease moves from organ to organ, or disease change the place, or disease is not cure properly in that particular individual. Some examples is that when diarrhea stops, rheumatism starts, gout stops, chest or joint trouble starts, eruption suppress, skin trouble starts, starts itching, purplish patches are coming. So you close one leak in the pipe and pressure builds and another pipe bursts. Means your one organ is get blocked, then it shifts to the another organ. Abrotanum patient does not heal; they relocate the diseases. In mental pictures, the Abrotanum anxiety stays inside, depression becomes silent, and cruel things arise without expression. Phatak gives very strong mental symptoms often overlooked. Great anxiety and depression, not expressive, not crying, just a deep internal heavy nation. In OPD, we see that the patient says that, doctor, I feel low, but I don't know why. Nothing excites me, nothing comforts me. Then another main characteristic symptoms of mind is cross and irritability, especially in children, seen in marasmatic children. Child refuses comfort, irritable without reason, cries when touched. Mother always says that, doctor, he is always angry even when we feed him. Third characteristic mental symptom is thinking difficult or loss of comprehension. Very important for students. Patient says that, doctor, my mind feels tired. After talking for some times, I feel exhausted. This is the mental fatigue, not anxiety driven. Inhuman and cruel thought. Fourth characteristic symptom Phatak describes that. This is not a violence, this is an emotional numbness. So, in mental or clinical picture that combines that cruel thoughts, marasmus, and metastasis is the abrotanum. In physical generals, in day-to-day OPD, we see that these patients are sensitive to cold, worse from cold air, from fog, wet weather, complaints worse at night, profound weakness, especially after illness, influenza. Phatak's one note is that removes the weakness remaining after influenza. For that, we can have another remedies like sorinum, china, lycopersinum. These remedies are help of removing the weakness after influenza. Appetite is good, child eats well, yet fasting continues. This is the key of contradiction, that eats well but appetite is well but yet fasting. So another characteristic triad we can simply tells us that good appetite but progressive emaciation, and these two combination we may think for that purpose. In stool complaints, worse after diarrhea checking, better from loose motion. Better from loose motion is the characteristic symptom of abrotanum. Patient better by motion, worse at rest and especially at night. In nervous system, numbness, weakness, trembling, paralytic condition. This especially seen in the post-illness status, elderly patient, post-surgical cases, or in the cancer patient. In children, emaciation mainly in legs, face looks old, wrinkle, blue rings around the eyes, pale and yellow-headed. Child eats but legs disappear. A simple keynote that we can remind: child eat but legs disappear, means legs gets thinner. In stomach symptoms, food passes undigested, offensive vomiting, in large quantity, coldness in the stomach, sensation of stomach swimming in the water, craving bread and bread boiled in milk is the characteristic craving of abrotanum, bread boiled in milk. In head symptoms, cannot hold head up due to the weakness in the neck, brain tired after conversation. In children's or post illness weakness. In respiratory symptoms, dry cough after diarrhea, that is gastric symptoms shift to the respiratory symptom. Pleurisy sequelae, pressure pain remains after pleurisy. So we can see that the diarrhea, then it turns to cough, and then it turns to chest heaviness. In abdomen, bloated, hard lump felt, weak sinking feeling. Phatak also mentions it in that it is useful in tubercular peritonitis. In rectum, protruding piles, burning on touch, for frequent urging with little blood. So in alteration in abdominal complaints, piles alternate with rheumatism complaints. So pile disappears and rheumatism complaints or joint complaints start. Also in male, hydrocele in children's, epistaxis in boys. In female, darting pains in left ovary, suppressed menses, back pain associated with ovarian symptoms. In extremity, severe emaciation of legs, cold pricking, numb finger at the toes, rheumatic pains, limbs contracted after colic. So, in abrotanum, lower extremities are suffer most. So, we have to remember that lower extremity has to suffer most. In skin symptoms, loose, flabby, purplish discoloration after suppressed ray motion, chilblains with itching. So, these are the particularities of the abrotanum that mentioned by Dr. Phatak. Now, how to correlate these all generalities and particularities in our day-to-day clinical or modern practice of medicine. So, the child who is failure to thrive, malabsorption syndrome, post-infective weakness, autoimmune diseases with migrating pains, post-surgical chest complaints, tubercular tendencies, cancers. In cancer, I use abrotanum in mother tincture with patient have good appetite but severe weakness, or metastatic cancer patient with terminal stage having severe skinny, means their skin is touched to the bones. The hands and foot, all extremities have thin, become half of their original size, and the patient lost too much of weight. It gives patients to a revival state, or may his weight increased in many patients. So, in these clinical pattern, especially in cancer cases, a 10 drop at night mother tincture will help me many in cases, while building, means gaining the weight and feeling better in terminal cases, not curing, but patients have much improvement in their in all general state, and followed by a constitutional or pathological remedy will help much more. So, we have to differentiate many of the remedies with other remedies. Uh, so, abrotanum belongs to the group of remedies that with nutritional failures, disease shift from one organ to another organ. Suppression is the in suppression plays key role, and wasting is more than weakness. If appetite is good but tissues are melting, this is the abrotanum picture. So, common remedy, we first think that abrotanum and compare with tuberculinum. Common points are emaciation in children, failure to thrive, tubercular background, recurrent changing complaints, weak immunity. So, appetite is good in abrotanum, while tuberculinum variable or cravings. Nature of emaciation is progressive in legs, in especially in legs, in abrotanum, and rapid weight loss with restlessness in tuberculinum. Tuberculinum is more anxious, active, hyperactive, cannot stay still, while abrotanum is depressed, anxious, dull. In abrotanum, causes of suppressed diarrhea, metastasis, inherited tubercular miasm, disease movements clear, organ to organ shift. So, general instability is more important in tuberculinum. So, restless child is tuberculinum, quite wasted child is abrotanum. With calcarea carb, we also compare. Calcarea carb stores more fat, abrotanum loses more tissues. Both have common complaints of poor nutrition, delayed development, weak digestion. Then another remedy is sulfur. We have to differentiate in between sulfur and abrotanum. Both have emaciation, weak digestion, but alternating condition. ab thermally abrotanum is chilly, sulfur is hot. Abrotanum is depressed, dull, sulfur is egoistic and philosopher. Uh, in posture, weak, stumped posture in abrotanum, uh, weak posture and stumped standing thinker. Appetite is good, but assimilation is lost in abrotanum, where irregular ravenous appetite in sulfur. So, in one line, we can say that sulfur burns and abrotanum collapses. Disease shift after suppression in abrotanum and natural alternation in sulfur. So, we can see in these 4 or 5 remedies. Also in iodine also we can compare. Iodine burn fuels fat, but abrotanum never absorbs the fuel. It means that iodine has emaciation, hot patient, but his metabolic rate is high, while in abrotanum the energy intake or nutritional nourishment is deficient, that he eats well but assimilation is have a problem in abrotanum. In abrotanum due to poor assimilation, and in iodine due to over metabolism. In abrotanum needs iodine needs constant motion, and in abrotanum motion emulates the all paints. Also arsenic album has also similarities in weakness, chilliness. uh, Arsenic has anxiety with control, while abrotanum has anxiety with collapse. Also China, we can think of China has losses strength, abrotanum losses structure. uh, Abrotanum has migratory diseases, while China has exhaustive diseases. uh, in China, the more is the appetite is poor, while abrotanum has good appetite. In causes in abrotanum has suppressed diarrhea, or in China loss of fluids. In Braine also, uh, we can differentiate both. Have abrotanum has sequelae of diseases, Braine is acute. Motion aggravates the Braine, ameliorates the abrotanum. Braine for attacks, abrotanum for aftermaths. So finally, we can say that the when the after all studying the disease picture from Phatak, we can conclude in or we can say in few words that disease shifts after suppression is abrotanum. Child eats well but waits. Legs are most emaciated. Mental dullness with depression, complaints worse at night, cold and fog, better by motion and loose stool. So abrotanum is not about the appetite failure but is the nutrition failure. So highlights for 5 to 6 symptoms in which we can remember the abrotanum is that progressive emaciation, good appetite but poor nutrition, diseases shift after suppression, worse at cold, night, fog, better from motion, loose stool, mental depression and anxiety. Suppression is the cause and migration is the result of abrotanum. And for all these you have answer is abrotanum. So after that, in 3 words, I already discussed that marasmus, metastasis, and weakness is the key feature of abrotanum. Abrotanum teaches us many things, that disease never disappears, in only moves from one place to another place. Also, good appetite, suppression, shifting diseases, and leg wasting is also in abrotanum. And in potency selection, uh, I already told you that I use mother tincture in cancerous patient, and in children with marasmus I use 6 potencies week, daily 1 dose for 10 to 15 days. Then I review this, and then I see the progress. The remedies that may close to, or if we think of nourishment remedy as a abrotanum in children, may especially when parents or mother wants to their child to increase their weight and their build. So I used to tuberculinum in higher potency single dose in a 1 month, and abrotanum 6 in daily doses, or iodum 1 m in month and abrotanum 6 daily doses. Review the patient after 15 days. Many of the cases will have a good result, gains 1 or 2 kg in a month with good dietary advices and exercises. Child will get better in a month or 2 months treatment. In cancer cases, as already I told that abrotanum mother tinctures helps a lot. 5 drop or 10 drop at night for a month or for 15 days will help to revitalize the marasmatic or metastatic cancer patients. In these two cases, in these two type of cases, I use abrotanum. 1 or 2 cases of better after diarrhea or shifting cases, I use abrotanum 30 with good result. So thanks for patience listening. Goodbye.